All right. Hi, everyone. Thanks for joining us. I know that these lunchtime programs are always a little bit difficult. My name is Mike Asbach, and I'm joined by Joe Hughes, and I'll turn it over to you, Joe, in just a minute to give an introduction. So we are both psych PAs, and one of the reasons we wanted to do this is there's been, I think, so much interest in psychiatry and certainly the role of PAs within psychiatry. There's not as many of us as nurse practitioners or physicians. And we figured it would be a lot of fun to get on LinkedIn and not only talk to people that may be on this call with us, but then also have an opportunity to just have this be available on demand so that people that have an interest in learning more about our profession can access this. So before we get into things, I'll just tell you a little bit about myself. I am a psych PA. I've been a PA for 12 years. I've been in psychiatry that entire time. I fell in love with it pretty early on and have never strayed. And I serve currently as the Associate Director of Interventional Psychiatry at Dent Neurologic Institute. Dent is a pretty cool spot. We're up in Buffalo, New York. It's one of the largest outpatient neuroscience centers in the country. We do over 300,000 visits per year. And it's a lot of fun because we get to see some very complex and interesting patients due to all the neurologic comorbidity. So, Joe, let me turn it over to you to introduce yourself, and then we can get into things.
Hey, thanks, Mike. This is fun. I've never done a LinkedIn webinar before, so kind of a newbie.
Exciting.
I know,
Good.
it's kind of exciting. Uh, I'm Joe Hughes. I'm in Greensboro, North Carolina. Being a psych PA started for me about 14 years ago, but I began my PA career in emergency medicine, which I really loved. But then I really found that I love the hours and the challenge of psychiatry even more. So I ended up doing that, and I was in private practice. I've done inpatient, outpatient. I was a director of a Suboxone clinic. And recently I've just opened my own outpatient psychiatric clinic. So yeah, so even you and anybody who's looking can do this. I didn't know that was a thing, quite honestly, when I first got into this. I didn't think PAs could own their own practice. I know I was naive in that. And it was by meeting other people in our community that really opened my eyes across the country who have done that successfully. And I went, that's a thing. We can do this. And yeah, I'm doing it. I even have a psychiatrist that's working for me and with me. So just to there are many ways, and I have nurse practitioners and a therapist. So there's many ways to make this well-rounded and to make it your own. So it's exciting.
Yeah, it really is. And especially having the practice ownership perspective, because I agree. I think the PA profession is young and is evolving. And I think as we become more of a mature profession, there's more opportunities for us to see, not just as employees, but as practice owners or partners. There's a lot of really exciting things that are coming. And it's exciting too, I think, just because there's not a ton of us in psychiatry. I think the last time I looked, it's about 3,500 PAs. And yet there's so many PAs out there that have a passion for mental health that maybe are actually doing a whole lot of mental health in non-psych settings, such as primary care, internal medicine, oncology, even. Yeah. So I love the idea that we can hopefully just have a discussion of what Psych PA looks like. And then even at the end, we'll wrap up by talking about different pathways to enter. Because I think the thing that I keep hearing from PAs is I'd love to work in psych, but I don't know how to do it. Since so often the jobs are very hard to come by for PAs, or at least if you don't know what you're doing. So,
Absolutely.
Joe, my plan for this, we do have slides. I don't want to necessarily just read off of the slides. I'd rather just hear from you because you're the expert. But let's just have a conversation, and we can use the slides maybe just as a basis for this. And then if there's anyone that's logged in and watching this, if you guys have questions, certainly throw them in the chat and we'll try and answer those. But Joe, I'd love to talk to you a little bit about just differentiating Psych PA versus Psych NP, and then also regular psychiatrist physicians. Maybe we can talk a little bit about just the educational differences. Do you want to talk about how we get educated as Psych PAs?
So I can speak to my experience going through school. We're all generalist. I don't think that that's changed throughout. There's not just a specific psychiatric track for PAs. So we graduate as generalist, which is great. It gives us a lot of diversity and versatility for that. And I think that's been key attractive to a lot of students and people who want this profession. So yes, graduated with a generalist. We have to remain generalists, I think, in most states to practice with that certification. There are since I graduated in 2009, I didn't know of any fellowships or extra training, quite honestly, was even available. What happened after I graduated, though, was one of the extension qualification programs, which like were kind of our board certification. If we're following the medical model, my understanding was it's kind of, if physicians are board certified in certain specialties, then as us following that model, we're also going to make sense that we follow that as well. So there's 8 subspecialties. I think that we can get the CAQ, and psychiatry happened to be one of them. So you could go down that, and I did go down that pathway, deciding that's what I really wanted to do. But that was having worked, you have to work so many hours. I think your other slides show that, how many hours are qualified, work in psychiatry. And it's about, you got to kind of walk through the door. But there are now fellowship programs. I know more, like in Texas, I think there's one. There's some extensions of PA programs as well. And then I went on to get my doctorate. A year ago, I graduated with a doctorate in psychiatry focus. And at the time when I was doing that, it was only one program offered in the doctorate level at Rocky Mountain. Now I think Lynchburg has added a psychiatric branch as well for their doctorate program.
I think that's right. Yeah. So similar path for me. When I started, I graduated in 2012 and applied for a job in psychiatry, and it was generalist training, as all PAs are. And thankfully latched on to a incredible practice setting. Our medical director, Dr. Capote, has a passion for learning and mentorship, and a lot of it was all on the job learning. And I think historically in our profession, in us in psychiatry PAs, is a relatively new phenomenon, but I think a lot of the OG psych PAs that have been doing this for 10 or more years, it was all on the job.
Mm-hmm.
And things are changing a little bit now. And I think in part because there's such a shortage of psychiatrists, that having one-to-one mentorship or on-the-job training, while that's still certainly an excellent path to enter the field and grow your craft, it is becoming more challenging to do because there's just not that many psychiatrists out there. And a lot of psychiatrists that are practicing are doing so in a private solo practice, cash pay, where they may not necessarily have a ton of availability or interest in training. So we're seeing these alternate pathways crop up, and I think that's a net good. The cool thing about PA training is because it's on the medical model, it is generalist. We get a really broad building block fundamentals of medicine, and then we can work on that. And that's one of the big differences as we're talking about PA education versus NP, is NP education is going to be more specific to that specialty. So as we're talking about psychiatry, NPs are going to have their, and I always screw this up, their PMNHP, something close to that. And that's going to be psychiatry specific. So if you have an FNP, a family NP, they can then pursue their mental health certification, or you can go to school specifically to become a psych NP. That's always one of the big differentiations between PA and NP, is PAs have a little bit more lateral flexibility in their careers where they can move from specialty to specialty without any additional training. PAs as a profession have a greater emphasis on collaboration and on-the-job training as a result. And that can be a blessing and a curse, because in psychiatry, sometimes it's difficult when we don't have psych-specific training. We have a passion or an interest in psych, and yet we're applying for jobs and competing against NPs that went to school specifically for psychiatry. So let's actually finish off, Joe, by just maybe highlighting a little bit about psychiatrists. I don't think we need to do a ton here. Most people probably are pretty familiar with medical school and how this works. But I just want to make sure that as we're talking about the 3 major professions that prescribe in psychiatry, psychiatrist is the last one. One of the big reasons that I think we're seeing such growth of PA and NP in psychiatry is just that it's one of the fields of medicine where the needs for mental health are just continuing to grow, especially post-COVID. We're seeing more and more things come out about loneliness and rising rates of depression and anxiety, both in adults, but also in our adolescents and children. And as we're having greater need for mental health care, we're also unfortunately just not meeting the workforce requirements, especially in psychiatry. Some estimates are that we're maybe 10 to 12,000 psychiatrists short of where we need to be. Half of US counties don't even have a single psychiatrist.
Yeah.
So it's a really exciting thing in psychiatry, where I don't think you have nearly as much of the turf wars that you're seeing between PA, NP, and physicians in other fields, because I don't think there's this feeling that anyone is stealing each other's jobs, but rather a really collegial relationship where everyone understands that there's far more need than available workforce, and we're all in this together and here to help. I think also psychiatry as a profession, or mental health as a profession, is one where we're used to having multiple professions in there: psychologists, social workers, psychiatric pharmacists. There's a lot of degree diversity in psychiatry. So I think having people other than physicians as providers is also something that is maybe a little bit less foreign. But I'll pause there and just see if you want to add or correct any of that before we move on.
No, I would agree. I think we all know, if we're in the medical profession, we all understand that psychiatrists are medical doctors first, and all that comes with it, the 4-year residency, and then they specialize, right? And they can specialize into child and adolescent, forensic, or addiction psychiatry. And those can all be done later as well. And then true like PAs, if they're a generalist, they could get a fellowship into psychiatry if that's something they want to do as well, and add that to their educational level. So again, I think it's really important, like you said, to really understand the difference of education and how nurse practitioners, PAs, and psychiatrists, again, I really want to emphasize how PAs, our profession was designed to follow the medical model and all that means. And I think that gets lost sometimes in the translation, because our educational is usually hands-on in school, where a lot of nurse practitioner programs tend to be online, at least a lot of the majority I see, especially in the mental health area. If they were family nurse first and then they go into that tends to be an online program. And as far as I know, I don't know any PA general program that's online. Is that accurate? I don't know. So
Yeah,
we're all
no,
kind of
Yale had one. Yale had one, and they shut it down actually. So
yeah.
everything is
I,
live and in person.
I think, and so, and I really think, maybe I'm old school on this, but I really think that makes a big difference in the educational process when you can be all hands, all in, doing it 100%. And that's, again, how I think that PA is more aligned with the psychiatric, the psychiatrist,
Mhm.
medical doctor.
So here I've got an interesting thought, and this might be
Yeah.
provocative. So
Ooh.
I'm going to bounce it off of you. So here's the way that I kind of think about professional roles. So I think about psychiatrists as being the subject matter experts. They went to school for a very, very long time and have a really, really deep training in not only medications, the pathophysiology of disease, but then also counseling, psychodynamic therapy. They're the subject matter experts that have had
Mhm.
exposure and training in a lot of different fields. PA and NP, the whole idea behind our professions is to shorten training so that we can put more people into the workforce, have an accelerated pathway. And the trade off for that is our scope of practice is going to be more narrow or more limited. And that may evolve with time. A
Mhm.
PA or an NP with 30 years of experience is obviously going to have a very different scope of practice than a new graduate who has zero experience.
Right,
But the
right.
way that I think about it is PA is taught on the medical model. So we're receiving pathophysiology, anatomy, and that general training is very scientifically heavy. And I think what ends up happening is PAs in psychiatry, our training really aligns well for psychopharmacology, prescribing, understanding the underlying neuroscience, the reason that the machine is working that the way it is. But PAs don't have really any formal training in counseling, in psychodynamic
Agreed.
therapy. Certainly, there's some of
Mhm.
that may be in PA school, just as we're talking about behavioral support in medicine, but there's not as much training in that. NPs, the nursing model is very different than the medical model, and a lot of the NPs training is emphasizing patient centered care, the family dynamics, the psychosocial issues, social determinants of health. So even though NPs and PAs may fill very similar roles out in the workplace, the training models that get there are very different, where NPs are going to be much stronger in the counseling, psychodynamic side of things, where PAs, I think, are much more strong in prescribing. So that doesn't mean that PAs can't be good counseling or do good counseling, and that NPs can't do good prescribing, but rather that post graduation, those are areas to then continue to emphasize and reinforce with education. Where psychiatry, I think, because the training program is longer, they end up having a lot of expertise in both of those areas. So
I think
is
that's a
that
really
is
good
that maybe it's less controversial, but I'd love your
point.
thoughts on that.
No, I think that's an excellent point. Coming out of my generalist program at Wake Forest, and I want to also preface this conversation is, I don't think we're better than NPs. That's not
No,
what
yeah.
I'm saying.
Hmm.
I value my nurse practitioners highly, and I think they're very well trained and they're great caregivers and clinicians. So I just want to preface that. Um, but coming out of PA school, I, had one section on psychiatry. I mean, it
Mhm.
really, you're right. But the medical aspect of it, I agree. The neuroanatomy, the mechanism of neurology and medications and how they was a lot more ingrained than the therapeutic. Now, when I did do the doctorate program, I will say one of the benefits of that for me was I had two courses in therapy. I had one in CBT for a semester and one in motivational interviewing, and they were fantastic.
Mhm.
So I think that you're right. I couldn't agree more. I think that was very well said about the differentiation there. I like that.
I think it highlights the importance for
Yeah.
both PA and NP as a profession to really continue to commit to lifelong learning. And anyone in medicine should do that. So physicians are not immune to that as well. Heck, half the stuff that we do in our interventional practice was not even a thing when my medical director was in med school. So there's always a need to learn, but I think acknowledging the strengths of our didactic training versus the areas that we need to make sure we're putting extra emphasis is a really important thing so that we're continuing to be the best providers that we can be.
Be the best you can be, man.
Absolutely right. We should coin that phrase.
I know, right?
All right. So, as I said, I'm just trying to rotate through these slides, but we're not necessarily going to touch on each point of this because I want to make sure that we also have time, Joe, to talk about just how PAs that are interested in psychiatry may be able to access that. So, as we're going through this, the big thing, just in terms of scope of practice and prescribing authority that we see on the slides here, PAs can prescribe in all 50 states. And I want to call that out because even now, you and I both do a lot of work with industry and education. And I think there's a big misconception, even in people that regularly interact with PAs, that we may have more limited prescribing privilege. In all 50 states, we can prescribe. There are a few states that have greater limitations on PAs or NPs in terms of controlled substances or class
Mhm.
2 or only a certain number of free fills for certain meds. But in all of those states, we still do have full prescribing authority, including DEA licensure. So this is something where we don't have a restriction outside of controlled substances, anything like that. And that's important, obviously, because I think last time I checked, 80% of psychiatric care or psychiatric provider roles ends up being medication management. So as we're talking about PAs having difficulty getting into the field, sometimes we need to educate because there may be a misconception. If you're applying for a job, they may think that you're not able to prescribe all the meds that are necessary for that clinic. So making sure that they're aware that there aren't prescribing restrictions there is an important thing.
Wasn't Florida one of the last ones to come on board with controlled substance
I
prescription?
believe so, right. Yeah, and I think there's still a little bit of restriction on controlled substances, but there's a carve out for behavioral health now. So in
Oh, good.
behavioral health, I
Yeah.
believe psychiatric PAs can have full prescribing authority across the spectrum.
And I really encourage those that don't quite know the rules to contact their state or local
Mhm.
association because they should have a good resource for you, hopefully, and getting this information for you in your area.
Absolutely. Yes. Huge, huge benefit when you join your state organization. All right. So let's talk a little bit about the CAQ. Joe, do you have your CAQ?
I do.
All right. I do as well.
I actually recertified for it. I hit the 10-year mark with it. I was like,
Oh, very
oh,
nice.
yes.
Yeah. We're getting old. So I was the second person in New York State to get my CAQ. I got it in 2013. So I think it was the first or second year it was offered.
Yeah, I got it soon. I got it
Yeah.
in 2013 as well. So look at us being rock
I
stars.
know, right? So let's talk about this a little bit. So CAQ, just for maybe non PAs or people that aren't familiar, as Joe said earlier, there's I think 8 different specialties where now PAs, generalist training in school, but then after you graduate, you have the opportunity to sit for a specialty exam that gives you the Certificate of Added Qualification. This is not a specialty board. Please, anyone that's talking, it's a pet peeve of mine when PAs or NPs say that they're specialty boarded in. That is not what this is. This is not a board. You're not board certified in psychiatry. It's a certificate of added qualification. We always want to be precise in our wording. And we see down below here, you have to be a PA. You have to have active licensure. You have to have experience. I believe it's 2,000 hours, but
Yeah, I think you're
okay, 2,000 hours. I should have put that detail in there.
100 something. It's
Yeah.
around there.
Okay. About a year to 2 years of experience, and then you have to do a certain number of CME, and then have someone sign off on competency in certain procedures and patient cases. So the CAQ is a little bit controversial in the PA world, and the reason being is we very much pride ourselves and hold ourselves to the generalist mentality that we have lateral flexibility. But what has happened is as autonomy in PA practice has continued to grow, more and more roles, especially in psychiatry, are asking PAs to be autonomous providers. I think the need to have these specialty certifications to demonstrate that extra level of competence or training is important. But I think one of the challenges with CAQ is it's based on the job experience. So it's hard because if you're a PA that does not have the CAQ, you're applying for jobs and competing against NPs that have their Psych NP certification,
Right.
you still have to find a practice that is willing to take you on and give you those hours so that you can sit for your CAQ. And we'll talk maybe on the next slide about some alternate pathways. But Joe, I'd love your thoughts on the CAQ and maybe some of the challenges that come with the on-the-job training requirement.
So I got the CAQ, and just a little why I did it. I'm an independent contractor since I've been practicing psychiatry, and I saw it. The light bulb went off for me that insurance doesn't want to pay us like the amount that equitable to physicians, and we can argue that in many ways, for the same codes. So I saw it as insurance companies looking at another reason not to pay us because we don't have this. If it's available, why don't you have it? Why should I pay you this price for that? That's what I was like, yeah, all right. That makes, so that kind of jettisoned me into, I want to make sure. And plus I think I love learning. And I'm like, if this is where I'm going to land, I might as well show it and give it a good force of it. Like, this is it. This is what I like. I want to make sure I have all the certificates, the accolades that I can have when it comes to psychiatry, because I've dedicated, this is where I want to be. So that's kind of why I did it. And I'm happy I did it, but you're right. The experience, it's that catch-22.
Mm-hmm.
You can't get a job here because you don't have I want 1 to 2 years experience. Well, I don't have, how do I, so hopefully some of these other things that you talk about, like fellowships and such, can, and more places offering mentorships, perhaps, like that might be something we can look at in the future with more practices like mine.
Yeah, absolutely. So my take on it would be that if you are practicing in psychiatry, or even if you are in family medicine, because if you look at the hourly requirements, I think someone that is working in family med, a huge component of your day is psychiatry. There's still
Yes.
opportunities to get the CAQ. The CAQ will not hurt you. If you have a CAQ in psychiatry, it's going to make you more competitive in the marketplace. Time after time, the thing I hear from people, from PAs, is that they struggle to find jobs because they feel like they can't compete against NPs. And unfortunately, it's a lot of times just a lack of knowledge, but sometimes it's a lack of opportunity for those on-the-job mentorship training periods. So if you have the ability to get the CAQ, I strongly recommend it. But let's talk now a little bit about some alternate pathways. So for someone that does not have any psych experience, is interested in psych, what are the ways that you can break into the field? You mentioned earlier, Joe, some post-grad residency programs. So in PA world, these post-grad residencies are still kind of an unregulated hodgepodge. There's not really a ton of formality to them. But I think the post-grad residency, it's a really wonderful thing. And there's, I think, maybe 12 or 15 of them now. Usually they're about a year long. They pay you a stipend. It may not be a pay that is market rate for a practicing PA. It's a little bit lower. But then in exchange, there's some didactic time along with clinical care and lots of mentorship that comes with it. So if you have an opportunity to do a residency, I think this is a really wonderful thing. Most importantly, though, the residency then is on your CV. So if you're applying, you don't have your CAQ, you are just a generalist PA, but then on your CV, you have this residency that was completed in psychiatry with X number of hundreds or thousands of hours of psychiatric training. That is going to immediately put you at the top of the pile and demonstrate that you are committed, that you're in it to win it in this
Absolutely.
field. So I think that is a wonderful option, but it's also one that takes a lot of commitment. Moving beyond that, I think there's an incredible opportunity for CME. There's a lot of really great high quality medical education out there. And if you're someone who is a PA, you don't have psych experience, you want to break into the field, even just attending some CME conferences in psychiatry can be very valuable. And I think that's valuable for a couple different reasons. If I had a new grad or someone with 1 or 2 years of experience as a PA that was applying to my clinic, and maybe they're in family medicine or emergency medicine, and they put on their CV or put in their cover letter that they've attended a psych specific conference and have done 100 CME hours in the past 2 years in psych specifically, as a potential employer, that gives me more confidence that they're going to hit the ground running, that they are really eager to learn, that they've made a commitment to lifelong learning. And additionally, I think there's an incredible amount of networking. that can happen at these conferences. And we can
Absolutely.
maybe talk about an upcoming conference that we're both very excited about. But on the in-person live conferences, especially when we didn't have those during COVID, it really reinforced me how important they are, because it's an opportunity to meet other PAs. And man, the farther I get into this career, Joe, and I don't know if it's similar to you, the more opportunities come to me just because of people we know.
100%.
Hey, someone calls you and says, I thought of you. This would be a great journal article. Do you want to partner up on it? Or all
Yeah.
these other things. So networking really matters. And if you go to a psych specific conference, you meet other PAs, you meet PAs that may be hiring in their practice, such as Joe. That's a really great way to break in as well. But I'll pause there and get your thoughts on the CME side, and maybe we can talk about Psych Congress and how that fits in with
Yeah,
this as
yeah, yeah.
well.
I was gonna mention that. I 100% agree. If you're a PA that's looking to get into the psychiatric world, but don't have the CAQ yet, and you're feeling what Mike has mentioned as far as not sure you'll be able to compete with a psychiatric nurse practitioner, yeah, I think showing, hey, I've done everything I can do, whether it's in the residency program or it's attending the CMEs. If you're interested, I agree that in-person ones add another layer of immersion, I think, in the whole experience, because then not only are you in the classes, but then if you're meeting people, you're talking about your different practice, you're talking about your areas that of specialty, perhaps. Maybe child, you have a case you can discuss with colleagues that's particularly challenging. And then showing that, yes, again, I think it's just that foot forward, that these are the efforts I'm taking, I'm put in place to help grow and educate myself, because I'm really dedicated to this. And as Mike mentioned, there is an opportunity, actually, for the first time that I'm aware of. There's going to be a PA Institute that's sponsored by Psych Congress in Boston this October 28th and 29th. It's at the beginning. If you've ever attended Psych Congress, the big 1-year event, this is their 1-year event, and we're going to be in the front loading of that Congress on the Monday and Tuesday, and the Congress starts Wednesday officially. So this is the first time for PAs. We're going to have some really fabulous speakers, Mike and I included, but along with some Jonathan Meyer, Greg Mattingly, and Rakesh Jain are all going to be part of our speakers as well. So this is a great opportunity to kind of get into that some of that CME that we're talking about.
Excellent. So we talked a little bit about on-the-job training. And what I would say with that, I just have a couple more thoughts, is don't rely just on jobs that are posted on Indeed or LinkedIn, because so often those jobs may be listing for a psych NP, and that's not necessarily discriminatory against psych PAs. But what happens is there's 25,000 psych NPs and there's 3,000 psych PAs. So a practice manager may put a job listing up for an NP simply because that's what they know. They don't recognize that PAs can fill that role. But I would strongly recommend to people, if you want to work in psychiatry, you're not in the field of psychiatry, because I feel like once you're in, because it's a small world. There's lots of networking. Typically, if you're in any size of a city, you're going to know the other people, the other offices, what everyone's doing. If you're trying to break in, get boots on the ground. Take your CV, get dressed up, maybe even grab like some cookies or coffee, and show up at those offices. So the average practicing psychiatrist is over 65 years old. Psychiatrists are 2 times more likely to be in solo practice, in private practice, than any other field of medicine. So there is still a ton of practices out there where it is a psychiatrist flying solo, seeing patients, and statistically, they're probably over 65 years old. So I think there's just an incredible opportunity to create a job. If you show up to an office and you say, I love mental health, I'm really passionate about it, I'm trying to break in, I'm eager to learn, there's a lot of practices that maybe aren't actively looking for a new provider. But if you show up and you impress, you may be able to create a job, because there's a lot of people that are looking to start winding down. I mean, they always say psychiatrists don't retire, they practice till they die. But maybe that psychiatrist doesn't want to practice 5 days a week, 60 hours a week, taking call every night. And if someone can come in and say, here's a solution to the problem you didn't know you had, I think that can really go a long way.
I think, I mean, to that point also, we're all, a lot of them are burnt out, right? And who has time if they're seeing 20, 25 patients a day? to stop and interview. I mean,
Yeah.
if they're solo practice, they are humming, right? And they
Mhm.
might be thinking, who's going to take over my patients? Like, I can't leave because how I can't abandon these people. So
Correct.
that's
Yeah.
something else. Um, as you're thinking about it, I think that that's a really good in. Like, just show up with cookies and go, "Hi, I'm here, and I can do all this, and I would love to be trained, and I could take some of the burden off this, and I want to learn." I think it's a great in. It's a
I
good
love
idea.
it. All right. So more controversial takes. Here's my controversial take on advanced degrees. If
Yeah,
you are watching this and you are interested in breaking into psychiatry as a PA, I do not consider a doctorate to be the way to do it. If
agreed.
you are practicing in psychiatry, you know that this is your field, this is where you're going to be, then sure, go for it. But please do not go spend extra tuition dollars to try and break into this field, because I don't think that having a doctorate in psychiatry makes you that much more advantaged over a residency, over CME, or just continuing to really network and try and sell yourself to a practice. So, Joe, my doctorate is not in psychiatry. I got my doctorate in healthcare leadership. And one of the reasons for that is I intentionally did not do a clinical doctorate because I felt like if I wanted to become proficient clinically, there was alternate paths for that that wouldn't cost as much money. That wouldn't require $900 per credit hour. But you did do a clinical doctorate, and I
Mhm.
know from our conversations in the past, you felt that that was an incredible accelerator of your knowledge and your ability as a clinician. So I'd love to hear your thoughts on the clinical doctorate and maybe where that should fit in. When should people consider going and getting a doctorate as PAs in psychiatry?
That's a great point, and I agree with all your points. I starting into this, no, don't do it. First of all, make sure you really like it. As once you get into it and you have this idea of it, once you start working into it, I recommend getting your CAQ first. If you're like, okay, I like this, I want to start building my education, I want us to be more marketable, that's a great place to start. Then once you're in it and maybe you want to push it even further, like in speaking for industry or speaking for CMEs or having more leadership position, then you might want to consider the doctorate. And honestly, I don't know if it really, my controversial topic is I don't know if it really matters which one you get. I'm sure you had much more leadership training than I did, of course, in mine. Again, it depends on which way you want to go with it. As I just opened my new practice, which required a lot of leadership, I'm just going to say, um, I probably would have benefited from the leadership portion of that. Uh, but I really love the idea of getting the more academic side of that and growing that piece of it as I like I said, I got the therapeutic education I'd never had before. And so just some of those things and just even the diagnostic classes were very, very helpful and quite surprisingly actually. But yeah, later in life, I mean, not unless you have other visions of going further along in your career in a different path outside clinical practice. I agree.
Absolutely. So these last 2 points, I'm going to kind of bundle them together. I think professional association and mentorship very often can go hand in hand. So, Joe, you said it earlier, your state organization is so valuable. I think every healthcare professional has an obligation or a duty to support their state organization. The reason I say that is almost all regulation of medicine happens at a state level. So, how you practice, what you're allowed to do, what you're not allowed to do, that's done at the state level. And if we aren't joining our state organizations, we don't have a voice. We don't have an advocacy for us on our behalf. I'm young. I always like to think about, I hope to do this for another 30 years because I love what I do. I want to make sure that spending a couple $100s per year on my state organization's membership is an investment in my future to make sure that 30 years from now, my practice is still healthy and vibrant. I think state organizations and specialty professional associations also offer an incredible opportunity for mentorship. If you're someone who is interested in psychiatry but trying to break in and you join APAP, which Joe, you can maybe speak to, that I think probably plugs you in with an incredible network of experienced and really gifted psychiatric PAs that can help you along the way, that can give you guidance, that can help you avoid landmines. I always like to think about mentorship as something where we're going to avoid all the screw ups that the mentor had earlier in their career. And I think
Like a
the
parent.
profession, yes, right. Professional associations are so important. And I think the mentorship that comes with those in the networking and the community is just such a valuable thing, especially for people that are trying to break into this field. Now I'll give it to you for maybe final thoughts on that.
No, I agree. And I'm embarrassed to say I didn't really break into or really participate in this until like the last couple of years. Um, and I was just focused on busy and getting my experience and just nose to the grindstone. But you're 100% right. Being a part of the organization in your state, that's where it all happens. Like all policy, that's where we need to focus on. And sometimes you can even do local, like regional as well. So don't, if you're going to do it, at least, join and then kind of dip your toes in some committees to see how you feel, how it's run. And I definitely encourage you to do that. And APAP is a national organization. It's Association of PAs in Psychiatry. We are a small group. It's been around since the 1990s. And but we're growing and we've got some new interest and we're co-hosting and part of this PA Institute. So we're definitely getting some recognition in the community more so. So if you're interested in psychiatry, I encourage you to join that national organization as well.
Yeah, and I think it's exciting. Just in the past 2 years, if you look at the data, there's an extra 1,000 PAs that have joined the psychiatry ranks in 2 years.
I know. We
So
went
it's
from
just,
like 1.5% of all PAs to like 3%
yeah,
of people who recognize themselves in the PA profession as psychiatric focused.
right.
I'm like, let's go.
It's exciting. So I hope that equates to continued growth at such an explosive level, because it really is such a great field and we can make such a difference for people. But I think what you're going to see is more and more of a national presence with APAP, but then also things like Psych Congress, these
Absolutely.
opportunities to have more networking, more visibility. And I think that helps because so often, as we're talking about difficulty of PAs breaking into psychiatry, a lot of it is not malicious. It's just a lack of awareness. And we very often have to advocate for our profession and help potential employers understand the roles that we can have there. So I think it can be a really important thing. And I hope that moving forward, as we continue to become more visible, that'll make a big difference.
Well, and like yourself, like you run that Knights of the Round Table publication that comes out, which is really fun and exciting and with a lot of valuable information, not just about psychiatry, but a whole breadth of things about just leadership in general and how to grow financially. There's so many. What I love right now too is that we're PAs in the psychiatric field are becoming more known, but in leadership positions, we're seeing PAs speak at these big conferences, taking on bigger roles in faculty, steering committees. We're in the room where it happens. And I think that is, not to quote Hamilton, which I
I
love,
was going to
but
say bonus points for the Hamilton quote. Yep.
right. But it's so true. We're finally like, hey, hi, we're here. We're part of the team. Let's like get me in, coach. And I just love to see how PAs are being more represented in that space. And one of the things I love about Psych Congress, the whole reason, honestly, I even went, my first conference ever was because there were two PAs on the steering committee. And
Mm-hmm.
so, I mean, truly,
Yeah.
that's the reason I picked it. I tried joining, and this has just been my personal experience. I went to look at APA, like, oh, I would love to join it. I couldn't even join as a PA. And I was just so aghast by that whole concept. Like, what? I can't join? Like, this is, anyways. So I really love the inclusion that is happening. I think that we just got to keep that momentum going.
Was 2021 your first Psych Congress?
No, I think I'd gone before then.
Okay. I
Yeah.
met you in 2021
Yeah.
in
No,
San
it was.
Antonio. That was the first time you and I met when we had dinner together.
That's right. That's
Yeah,
right. It
yeah,
was. Yeah.
yeah.
Yeah. No,
Okay. I wasn't sure if that was the first one or not.
no,
Anyways,
I've
yeah.
been
So as
like,
we're talking about networking, right? The
yes.
power of networking. So Joe and I met. We connected because we went to dinner in San Antonio on the Riverwalk on Day of the Dead, which was super cool.
Oh, it was so
Uh,
cool.
yeah,
Yeah.
it was so much fun, but we had a great dinner with a bunch of other colleagues, psychiatrists, and a couple NPs, I think. And it was just a really wonderful night of networking and the start of an amazing collaboration, professional relationship,
Yeah.
and friendship. So please, definitely, I think the networking that comes from CME, from professional associations, I cannot emphasize how important that is. I think in medicine, we often undervalue that because we think about this as something where we just show up to our clinic and then go home.
Yeah.
But in our world, everything is becoming so interconnected because of technology and social media there really is incredible opportunities to just build those connections, and you never know when they're going to become valuable or offer new opportunities.
100%. And I have to say, it also takes some of the burnout, if I'm going to use that term, like of just the daily sludge of just day-to-day clinical. When you have a colleague, you can like text and go, oh my gosh, I can't believe this. Or, just anything that's happening. It's just not having to explain where you're at. I think it takes a lot of, it just takes a lot of, it bridges that gap for me.
Totally agree.
I value very much.
I love it. Well, Joe, I think that's a good stopping point. I think we hit on the main thing. So anyone that's watching it, thank you. I know we went about 40 minutes, so that was quite the conversation. If you guys have questions, shoot us a message. Joe and I are both active on LinkedIn. That's why we wanted to use this platform. But if anyone wants to reach out, I absolutely love getting messages from people. I try to do the best I can to help or redirect you. Greg Burns in Florida is someone who is probably sick of me, because anytime someone from Florida contacts me about a Psych PA question, I direct them to him.
He's a good resource.
Oh, Greg is amazing. Yeah.
He's amazing.
He's probably annoyed with me, but he's amazing. Yeah. So please reach out. We're here to help. I mean, we both are passionate about our profession. We're passionate about us advancing the profession in psychiatry. And I'm hoping that this was helpful for you, but definitely make sure that we connect if you haven't spoken to us in the past, or come to Psych Congress and find us, because we'll both be there, and we'll be happy to meet you all in person. But otherwise, Joe, thank you so much for joining me and giving me your lunch hour. And we'll have to maybe do this again in the future and bring some more friends on, because this was a lot of fun.
It was. Thank you for inviting me. I enjoyed it.
All right. Absolutely. Well, thank you, everyone. Thank you, Joe. Everyone have a great day.
You too.